everyone. My name is Dara Udo. I am a physician. I also have an MPH in global public health, and I am delighted today to be presenting this episode of the Advancing Recovery series Q&A session. The Advancing Recovery sessions are brought to you by the Vaccine Immunotherapy Center in collaboration with COVID Recovery. And the Advancing Recovery sessions are basically Q&A sessions which seek to bring the public pertinent, accurate, and timely information concerning all things COVID. Today's session is focused on vaccine hesitancy, and we have several different panelists joining us today who will be talking about different aspects of COVID in which they've worked in, as well as other issues that they have faced within their work and otherwise with individuals that have been vaccine hesitant and or resistant. Vaccine hesitancy has existed since pretty much the dawn of vaccines in general. Vaccines basically were initiated back in the 1800s by Edward Jenner when he created the first vaccine by taking pus from a milkmaid's arm and then inoculating it into an 88-year-old child. The concept, which was to help build your own body's natural antibodies against smallpox and further getting infection from smallpox, which was a very, very deadly and devastating disease then. Those same concepts are still around and present today in vaccines, but thankfully the technology behind developing vaccines has advanced quite significantly and is very top of mind, especially related to COVID and the COVID vaccines. So without further delay, I am excited to introduce our panelists today and to get into discussion. We have been receiving questions ahead of time via the website, but you can also comment below and have your questions answered during the session. So our first panelist I'm going to welcome is Darren Main. Hi, Darren, welcome and thank you.
Hey, it's so good to be here. Thank you so much for doing this. I've been a yoga teacher and meditation teacher and doing all kinds of holistic health related stuff for over 30 years. And my passion from this subject specifically, and why I'm so honored to be here, this stems back from my early days working with HIV/AIDS and ultimately testing positive myself, excuse me, and feeling that hesitancy to start HIV medications, which are they carried a lot of side effects in the early days. And sort of working through that, wrestling with that fear and that hesitancy to trust pharmaceuticals myself. And so now carrying that forward and both recognizing that people in the holistic health field or people who are drawn to more natural approaches to healing have some legitimate fears, but also helping them work through those fears so that they can protect themselves.
Wow, thank you, Darren, and thank you so very much for sharing your story and your journey. I'm sure it hasn't been an easy one, and we are very excited to hear a lot more. Next, I'd like to introduce Alexander Soto. Hi, Alexander, thank you for joining.
Hi, thank you, Dr. Udo. So as you see, my name is Alexander Soto. I am a training coordinator for a nonprofit organization in the Bronx. It's called BronxWorks, in which we service all of the community in the Bronx. We offer services, as we say, from toddlers to seniors. We feed, shelter, teach, and support. And I've been involved with a couple of different committees at work, trying to communicate with our staff so that then they're able to provide accurate information to our community members. We service a lot of seniors, a lot of minority Spanish community. And so there's been a lot of misinformation that we're trying to work to dispel in order to offer and make sure that everyone gets access to the vaccine. So it's one of the things that I'm really passionate about, trying to knock down all those myths, even within my family members and my community.
Right. Thank you. Thank you so much, Alex. And those myths have so much power. So I'm definitely interested in hearing a lot more about what things and mechanisms and tools that you've put in place to kind of help combat them. Next, I'd like to introduce Yazmina Bakat. Hi, Yazmina. Thank you for joining.
Hi, so I'm Yazmina Burkett. I'm an undergrad at UMass Amherst and living on a college campus in a college town right now. I've been able to get insight into conversations about the COVID-19 vaccine and vaccine hesitancies in young adults. Additionally, I'm a certified EMT, so I'm working in a vaccine clinic, which has granted me the ability to have conversations with patients about maybe what they were hesitant about before, but what allowed them to later get the vaccine. So I'm happy to be here.
Thank you so much, Yazmina, for joining, and thank you for your work as an EMT. I know in the height of everything, it was very, very complicated for you guys to kind of get in and do what you needed to do, and with the resources that you had. So thank you, thank you. And last but definitely not least, I'd like to welcome Maria Gonzalez. Hi, Maria, and thank you for joining.
Thank you so much for having me. Maria, my name is Maria Rosario Gonzalez Albuquerque. I am the Director of Communications and Immigrant Health at an organization based in Boston, but we serve the whole state of Massachusetts, called Healthcare for All. We've been around for many, many decades and always trying to help people access health coverage and healthcare, and have been very active during the COVID-19 pandemic, not just, trying to bring information to our communities, but also trying to figure out which ones are the policies that are going to help people access coverage and care during these times. And right now, we're managing a whole project on vaccine equity. It's the Vaccine Equity Initiative in partnership with the Massachusetts Department of Public Health, and we are helping an effort that's targeting 20 communities, in which we're helping people address a lot of the misinformation that was mentioned, hesitancy, but also access barriers, focusing on what we call the priority communities or populations that include, immigrant communities, BIPOC communities, LGBTQ plus communities, disability communities. So we have a lot of targets, and I'm going to be talking a little bit more about what immigrant communities are facing in terms of that disinformation, hesitancy, and other extra barriers.
Wonderful. Okay, so let's get right into our Q&A session. What I've seen a lot, of course, and that Alexander and all of you have kind of referenced, are the misinformation that's out there. There are several different platforms now, so that a lot of people have a voice, that some that should and some that should not necessarily have a voice. Let's start with you, Alexander. Are there specific things that you've seen prevalent on platforms that send messages, and what do you find people tend to listen to more, and why?
Yeah, I remember when my mom immigrated to the US, and she would write a letter, and it would take probably 5-6 weeks to get that letter. That is not the case now. Now, when information is published, it can be easily spread, whether it's good or bad. And in this case, there's a lot of information that is out there, and people sometimes don't take the time to even read past the first and second line to really understand the article, to really see that there is no base in science, there is no reputable reference, and they immediately forward that to friends and groups. I get so many things in my Facebook Messenger and my Instagram DMs with videos and things of people saying that this is what they're seeing, that this is what they're experiencing. And look, I told you, I told you so, kind of an idea. So I think that within social media, I right away tend to ask the question back, did you read the article? What is a reference? Where are you getting this information from?
Absolutely, absolutely. And it definitely is always a good idea to vet the information that you see on social media. If you read something and it sounds that it's fact-based, always fact check. And we have access to so many resources to be able to do that. So I absolutely agree. Yazmina, you're college age, and I'm sure social media is kind of a big platform, are there any specific things that you've seen trending and or circulating in your friends groups about the vaccine? And have you heard from your friends about who wants to get the vaccine and who doesn't? And are there specific reasons why they don't want to get the vaccine?
Yeah, so I'm unsure if it's just mostly like the college demographic with young adults, but I've seen a lot of people very excited and willing to get their vaccine. I've seen a lot on social media postings of like their vaccine card, really excited that now they might be able to socialize again with friends and extended family. Personally, within my own social circle, individuals I see weekly, bi-weekly, like colleagues and peers, a lot of them are vaccinated because it's just a part of like our employment. It's for safety reasons. Though this may be relevant to like the region where I attend university, like the Northeast, but I did do a polling on Instagram just to see maybe of my followers, which is it's majority young adults, college students, and some like older high school students. About 5% of 200 responses said that they were not going to receive the vaccine. And so I even further tried to see the reasons behind why they felt hesitant to get the vaccine. And it seemed like it was all across the board, like people said holistic reasons, medical, religious, and there were some that said personal reasons. So social, some said political, and then I asked, from whom they'd have taken these reasons, and that fell into like familial values and also peers. So I think for a lot of people outside of like a healthcare setting, like other college students, I think I know people who have said that they wanted to get the vaccine to ensure their own safety and their family's safety. And they didn't want to spread or transmit COVID to individuals that they interact with daily. I know there's a lot of other people. I feel like socialization, the social life is a large part of college life. And so, as the CDC has been stating, the vaccine is like the safest, maybe the most efficient way to get back to normal. So a lot of people are willing to get the vaccine to return to normal, to be able to socialize again.
Right. No, absolutely agree. And I think in a lot of circles that I've spoken to as well, people that were initially a little hesitant, knowing that they could get back to going to restaurants regularly, maybe traveling was somewhat of an incentive. There have been some very consistent people that have been vaccine or anti-vaxxers for a very long time, independent of COVID. And those people tend to fall into the bucket of more holistic remedies, even with younger populations who feel that they're relatively healthy anyway. Convincing them to put something inside of them, to take a vaccine, to take certain medicines, is something that's often very, very complicated. Darren, I know that in the yoga world, you tend to deal with a lot of people that tend to be a little bit more on the holistic side with naturopathic medicines and whatever else. And I do believe in a very, very efficacious and different modalities. But what have you found in that community has been their biggest hesitations and or resistance? And what have you done to be able to combat that?
I think that the big thing, and a lot of people find yoga or herbalism or Chinese medicine or all these different holistic methods of healing and wellness, and they're very excited because it seems to be a more natural approach, and that seems to make sense. And I think a lot of people have felt sort of burned by big pharma and all of this. The problem with that, of course, is that we don't just have villains and heroes. Like there's this gray area in between. And that while yoga is great for many things, Chinese medicine is awesome for certain things, it's usually not enough. Just like taking an antibiotic isn't enough. Most of the time you need healthy eating. And so I think a lot of people, what I have found is that a lot of people are just fearful of pharmaceuticals in general, and vaccines specifically. And they really, there's two approaches to that in sort of my world. One is to, for those who feel as I do, that things like vaccines are generally a good thing. One is to shame people and call them names and tell them how stupid they are. But I think the more effective way is to hold space and just let them think it through. And even give them a context, and maybe at some point in this conversation we can do that, like why yoga would actually advocate considering strongly doing a vaccine historically from thousands of years ago. And I think most people, there's some people that will never take it, but a lot of people, when you just hold that space for them and let them think it through, they usually arrive at a pretty wise conclusion for themselves. And so that's sort of where my work is, not shaming and telling people what to do, but just saying, have you looked at it this way? Why do you feel that way?
No, absolutely. And we'll talk a little bit more about that kind of motivational and kind of how do you reach someone that's hesitant? What are the better techniques to kind of get them to have their own buy-in? So getting to some of the questions that we've had come in, both for Alexandra and Maria, I know you guys work in very marginalized groups that basically really don't have access to certain resources, but they have a lot of questions. How are they reaching out to get their questions answered about getting vaccinated and being healthy during a time where it's really scary for everybody? I'm going to start with you, Maria.
Sure, and I'm going to actually shift the question. It's not how they're reaching out, it's the fact that we have to reach out where they are, right? You have to go to where they are. And as part of this effort that I was talking about, what we're doing really is going to them. And that means two things. One is we have canvassers knocking on doors with the right information and telling people where they are, asking them if they've already gotten vaccinated or if they're intending to get vaccinated. And then we actually have this categorization and the spectrum saying number ones are the people that have already got the vaccine or have signed up. Number twos are the ones that haven't but are leaning towards doing it. 3 is the unsure category. Number 4 is leaning towards no. And then you have the 5s that are the anti-vaxxers and many of the ones that it's very hard to move. So, I mean, I'm not giving up on them. We shouldn't give up on people completely, but at the same time, we know that that is going to take a lot more. So what we're focusing on is really like the group in between the what we call the 2s, the 3s, and the 4s, which are the people that are movable. Some of them are movable in the shorter term. Some of them are movable in the longer term. Now, when they have questions, we've noticed that the 3 big trends that we've heard about are they have access barriers first. It's like, how do I even register for this? Like, I've heard it's very complicated. I may not have, if they send me a link to register and I don't use the internet, I don't speak the language, for example, like that is a difficult way of getting to people, or the vaccination site is very far away from me. I don't have transportation to get there. So there's like these really practical barriers. The other ones are, people are worried about the side effects of the vaccine. So we try to like manage those expectations and tell them like they might have side effects, but obviously it's better to like just deal with a little bit of like any kind of reaction and then not having COVID and then getting sick and so forth. And the other one is the safety of the vaccines. That seems to be one of the ones that stick there. Obviously we hear other reasons, and we have isolated different reasons for hesitancy, including religious concerns. And if we talk about specific vaccines, we know the Johnson & Johnson vaccine, some members from different communities have specific concerns regarding that vaccine. But in general, I think the safety of the vaccines is a very big issue that we need to address. And we are as honest as we can, like with the information that we have and the fact that these vaccines have been developed, people consider them to be developed very fast, but at the end of the day, the technology has been around for a while, and that has allowed us to develop these vaccines in a speedy way. But they're trying to address those concerns is what we actually are dealing with. Now, the best way of doing that is who is delivering that message. It's not just the people that we have at the door. These are members from the community, people of color themselves, talking to them about their own experience getting the vaccine. That is very helpful. But we're also relying on community partners, community-based organizations and faith-based organizations that are talking to people, giving them information. They are trusted sources in our communities. And we're relying also a lot in churches, like having the churches on our side has been very important in the work that we do. They even hosting clinics themselves. And that is a model that seems to work to really like break that barrier and address some of that misinformation.
Absolutely, yes. I think it's a multi-pronged, multifactorial approach that needs to happen. In addition to also listening to the community and hearing how they want to be reached as well. Alex, are there different techniques or things that you've put in place with your organizations to reach marginalized groups?
Yeah, so we work, as I mentioned, with a lot of population. One of the populations that I'm very dear to is our senior centers. I know some of them, as Maria mentioned, live in a remote area and we're not able to come out and get the vaccine. So we do have van pickups that we're able to drive there, pick them up, drop them off at the location. I think that we want to capture those number ones right away, right, as Maria mentioned, and get them vaccinated so that then they can speak about their experiences. And it's very important to be open and transparent with people and let them know there are side effects that you may experience. Trying to push that down really and stifle that, it's really going to hurt in the long run. It's really to set the expectation right. It's really, really important. So I think we used to have weekly calls with our staff. It was like about 75 to 100, 150 people. In the beginning of COVID, we had our medical director, Dr. Littleton. She used to come on board. We used to receive a lot of questions. And it started really with educating our staff. We have about 950 staff members that they themselves were unsure about the information. So we were providing firsthand information. We have a doctor on board. This person can answer your question rather than someone that you heard or something else. So the foundation for us was to educate our staff, get them ready so that then when the questions were coming up for staff members, that would happen. We also created an internal directory with a lot of information in our share drives that had links for resources that had, the most asked questions that people had, where they can find vaccination sites, where they can find the latest of information. So we were always making sure that we were providing a lot of information. We also added to our internal signatures, links to sites and information so that way we continue to get easy access for people to get that information, because filtering out that misinformation was really important for us to start with our staff and getting them there. I don't know if you know, the Bronx is number 62, and that is not a good number because that means we're the last one in the whole state in health disparity. The Bronx is number one. So to add that on top, to have COVID and really impact our communities, we lost a lot of seniors, we lost a lot of community and residents. And we use that information to sort of, help people put a face to a name, to understand that we lost someone. And each of us lost a resident, lost a member, lost a participant. And we wanted to make sure that they understood that this vaccine was really important so that we would stop. We will sort of put, a barrier that can help prevent that from happening.
Absolutely, Alex. And I think that's very important. The last thing you said there are no barriers. I think at this point, everybody knows someone or has had a personal loss in their lives from COVID. And just knowing how far reaching and crossing color, gender, all different lines, this is it's a disease that affects all of us. So we need to be able to pull together to acknowledge that in order to work together on also to get us out of this. Okay, so Darren, thank you so much for sharing about your health issues and the things that you may have struggled with when deciding to get a vaccine. Are there other people that you have felt that you've come across that have other underlying health issues that might be concerned about getting vaccinated?
Was that for me? I lost you for a second.
That's Darren, sorry.
Okay, I got most of that. You know, what I find is that a lot of misinformation, and it comes at us from all these different angles. But the thing that it almost always has in common is that it's tethered to our lizard brain. It's very, it's like cotton candy for the brain. It's easy to get engaged. Oh my God, the vaccine is going to alter your DNA. You know, it's like this crazy talk, but it's like junk food for the lizard brain. And so when I work with people, and like with myself in my own struggles in the past, it was about connecting that fear-based thinking of the lizard brain with my more logical upper brain. But it's not enough to just say, be more logical. We have to almost create a bridge in the brain. And so what I do for like with yogis, people in my yoga class, is I bring it back to something that they feel safe and comfortable with. Like what Alexander was saying about helping people tap into something that's very real to them, very familiar, very connected. And I just talk about their yoga, how we roll out our yoga mat and we create this safe space and we literally stress ourselves out, you know, through these poses, and then consciously train ourselves to respond differently, to know how to deal with stress when it arises in this very controlled and safe way. And then I help them connect that to the vaccine. The vaccine is a very controlled, safe version of COVID where we can learn our lessons so that when we encounter the real thing, we're ready for it. And there's something about taking that calm approach that brings them out of the lizard brain and into that, oh, okay, this fits into my safe space. Not everyone, you know, as a couple of people know, there's some people are just probably not going to get it right away. But a huge number of people who are just hesitant, like, oh, okay, this is consistent with something that is familiar and safe to me. And maybe I'll give it a second look.
Absolutely. And I think you touched on some many important points, even in medicine, the way that we approach patients in motivational interviewing. If we are talking about smoking cessation, stopping smoking, weight loss, or just taking your medicines consistently, it has to come from a place of safety and trust and respect. Respecting someone's autonomy to make their own decisions. Like you said, some people are going to be resistant, and also creating a safe environment where they can ask questions and voice their concerns in order for you to appropriately address what connects to them. When people are online or otherwise and attacking other people, oh, you didn't get your vaccine, you're doing this, you're doing that, it's never a good space to make people feel comfortable in order to share their concerns with you. And legitimately, at the end of the day, whether it's fact-based or not, they are concerns, and they are things that within you are hindering you from being able to accept something that's foreign, that's new, right? Vaccines are administering something to someone that may be otherwise healthy. And that's something that we see a lot in the younger population. Yazmina, I don't know if you could speak to this, who feel that, oh, well, from what I've heard from the news, it's not young people getting really sick, otherwise feel invincible. Oh, my friend got it, it was just a cold, I don't need to get my vaccine. Are there ways that you've been able to talk to your friends that may have voiced those types of opinions to help convince them to get vaccinated otherwise?
Yeah, so of my friends, there were some who were capable of getting the vaccine early on, like back in January, they worked in a healthcare setting at a nursing home, but they were hesitant because, you know, it was the very beginning of the rollout. And so they were concerned of possibly what effects may arise after getting the vaccine. And I was talking to them and telling them, you know, like, not to echo what Maria had said, but this is technology that has been around for a while. It's been in development for a while. They've just accelerated it, but they've gone through the same process. And it's amazing that it was able to be accelerated to this rate and available at the rate it was. So they got the vaccine, and now, you know, after the first dose, there was no side effects. They felt perfectly fine. And, you know, they thanked me for like helping them reason through getting the vaccine. So
that's fantastic. Okay, just to jump back into some of the questions, we have had some concerns with people that are otherwise in immigrant communities that are undocumented in the US that do and would want to get the vaccine, but they're just really afraid of what that level of transparency would do or would mean for them and their families that they care for. Maria, I know that you work really closely with these communities. Are there any specifics that you've come across, and what things are you and your organizations putting in place in order to help make certain populations feel safer when they want to go out and get a vaccine?
Yes, and I know Alexander probably has things to say about this as well. One of the key things that I wanted to highlight is obviously undocumented immigrants, but I think in general, immigrants have a lot of concerns. Undocumented immigrants are concerned because they're asked about their ID. This is part of like the issue that we're having, that even though you don't need an ID and you don't need health insurance, you're asked about it when you register for the vaccine for the most part. So we're trying to navigate this issue. In many cases, we're able to tell people you don't need an ID, and sometimes they don't even ask about it, depending on the clinic, but there's no consistency with the providers. So that is an issue. So we're trying to find ways in which we can navigate it. It may be the person at the registration table themselves when they go to the clinic, because now there's so many walk-ups and walk-ins that you can actually do the registration there. It's training the person at the table to ensure that they say, do you have an ID? If you don't, that's okay. But if you have it, it helps me make the registration faster. But that's all you can say about the ID. And same thing with the health insurance issue. That's another issue that impacts a lot of undocumented and a lot of immigrants in general. People are thinking, well, I cannot get the vaccine because I don't have health insurance. And they're going to ask you for your health insurance. So you have health insurance. But what they have to say is, it's okay if you don't. It just helps us to process the payment for the administration of the vaccine, but that is not an issue. You don't need it. I always add, because at Healthcare for All, we have a helpline to help people access health insurance. We always have that extra step that says, however, there is no reason why you wouldn't have health coverage or access to healthcare services. Please call this number. We'll help you have access to health insurance. But this has nothing to do with the vaccine, and let's just get you vaccinated, because that should not be an issue. And then what you mentioned is like, people are going to be like, but if I sign up for this, if I give my name, they're going to know where I am and who I am and how the information is going to get to the authorities. So we need to tell them that information is confidential. It doesn't go anywhere. And definitely immigration authorities are not going to have access to that information. And the federal government is not going to have access to that information. That information is not going anywhere. And you need to be very sure that this is like safe to do this. And it's actually, everybody's encouraging all our neighbors, all our communities to get vaccinated. So we're all in this together, regardless of our immigration status. And having that conversation is helpful, but it has to come from a person that really has that understanding and is a trusted source. When I was talking about immigrants, and we cannot just talk about undocumented, is because many immigrants are very concerned about the impact of utilizing health services, even the vaccine, as it comes down to what's called public charge, which is this test that people have to pass in order to get their green card, right? So there was a lot of confusion. There were many changes in the regulation and people are very scared, but this public charge issue has been around forever. And there was a new survey that says that 1/3 of Hispanics who have not gotten the vaccine are actually pointing out to this public charge as one of the issues, like their fear that this is going to be in the way of them adjusting their immigration status. And the truth is that not the vaccine or any related services to COVID, and now not even health insurance, which was part of the rule for a little while, that's not part of the public charge rule. You don't have to worry about it at all. And please get the vaccine, because it's what's good for you, for your family, to keep everybody safe in your community. And we know that our immigrant community cares about the rest of the community, and family is a very big thing. So once you reinforce the messaging, that is very helpful. And I know, Alexander, maybe you want to jump into this.
In New York, I think that one of the things about a lot of our communities, and especially the immigrant community, is that you mentioned one of the things, and that is like, oh, is that going to impact any way my applications? I know New York, as far as being a sanctuary city, a lot of the residents, we actually have a program that helps people get into the Affordable Health Care Act, and they are able to get health insurance. But there were some barriers in the communication, people thinking, are they going to know? Who's going to know? And As you know, a lot of the times when people migrate, they move in with families, they're in crowded spaces, and that just helped spread, COVID-19, which also meant that they also needed to get vaccinated as a group also sometimes, because just as the spread, we also needed to make sure that then they went back to their friends and their family members and their communities and inform them and say, hey, it's okay, it's safe. So I think that in many ways we tried to mitigate that. But as you mentioned before, you hit everything, so I have nothing else to add. But the fact that in New York, I think that we also have the New York ID, which also kind of helped out to prevent some of that people just can go in and get an ID. So some of our residents already had that issue checked out.
Yeah, awesome. And Yazmina, you work directly at a vaccination site. What are you seeing as far as the types of people coming in? Are people coming in with their families and getting immunized? I know that back when COVID, and it still is ongoing, we would see one family member get infected and then it would just spread like wildfire, especially in marginalized groups where oftentimes you're living in very close quarters with your cousins and your aunts and other individuals. So it obviously in those communities was difficult to isolate and do all the things that we as healthcare providers have been trying to make sure that people do. Are you now seeing people coming in as units, as families to get their vaccines?
Yeah, so there's a diverse range of people who come in because, the CDC is just, 12 to 15-year-olds can now get the vaccine. There are large families that are coming in all together now to get their vaccines. It's mostly the kids who are getting it. I know most of the parents have already received it in the past. There's also, it's a clinic that's located on campus and it's campus run. So there's a lot of people who work on campus who will come down and just get vaccinated. It's a walk-in clinic now. I think a majority of clinics are like that too. So it's exciting to see everyone come in and be excited to get vaccinated.
Absolutely. And I'm hearing more and more people say that, like, oh, I've been vaccinated, or I had my second shot X amount of weeks ago. So it's an exciting time for everyone. So Darren, I know you work in a different population. You're out on the West Coast and most of the panelists are over here on the East. Has there been a different mindset in general through this whole period of time, specific to the vaccine and as well as COVID? Because I know that restrictions were a little bit different on that side of the country.
Well, as I've been listening to everybody talk, it's interesting to hear how there's these different challenges in different communities. But while they're very different challenges, they also have some, so like a Venn diagram, they're all sort of similar. And one of the things I've seen is that two things can be true at once. One is I can have a really good reason to question like the safety of a vaccine or whether or not it's safe for me and my community. There's reasons people of color, the immigrant community, people who have sort of had bad side effects from drugs in the past, whatever it is, there's reasons they feel that way, and that can be true. But then there's this other truth that is there as well, which is, yes, you have a reason to question, to doubt, to fear, to be concerned, but you also have a good reason to consider like working through that fear, because whether or not, however good your reasons are, the result is potentially you and your family being at great risk. So I think in the yoga space, as I work with people, it's helping people say it's okay to feel unsafe around this thing you're being asked to do by the medical community. You have good reasons, but calm yourself, come to that space of calm, rational decision making, because you can both have that fear, but also rethink your decisions. Not every situation is the same, right? Not every pill is dangerous. There is a time to take a vaccine and maybe a time not to, but it shouldn't be driven by your past fears.
Right. Well, I know in my own experience, I have had periods of time where I want to say frustrated, but just bewildered. I've had patients come in that literally have a father, mother, cousin, brother that are admitted and on a ventilator because of COVID, and them themselves are still hesitant to go and get vaccinated. Do you guys have similar experiences where you've tried to have a conversation with someone about getting the vaccine and they have continued to be resistant or hesitant for their own reasons? I'll start with you, Alex.
I am in like 15 different WhatsApp chats, right? And in every one, it faces a different challenge. So initially, my mom and I we got our vaccinations. Was very happy to post it on social media. And someone actually messaged me, and I forgot to mention this on Facebook. They say, you're poisoning your mother. Why are you putting that poison on your mom on the public forum? And I messaged that person and I said, and I try to have an empathic conversation with that person, saying, do you know that message, the impact that it had, not on me, but it might have on my mom? My mom just like, why is this person saying that you're poisoning me, right? So in a lot of ways, these conversations sometimes are best taken out of that public forum into a one-on-one, which is what I have done on a lot of these individual WhatsApp chats, like saying, hey, can you tell me a little bit more about where you got that video? Oh, I just received it from someone, so I just send it forward. And I said, sometimes we got to be very careful about the information that we're putting out, because it's just going to confuse people who are on that teetering on which way to go when it comes to that communication. And a lot of the times I tend to post positive articles about, hey, people who are famous and people who are getting vaccinated, and just saying, hey, look, I didn't have any side effects. Don't tell my boss, because she thinks that I have some side effects. I was just kidding. So I told Dr. Wood about that. But, there are people who are having these side effects, and it's okay to say it's fine, right? Because I think that when we say that, we're normalizing those side effects, and we're making it okay to get the vaccine and still have the side effect, but the outcome of it, or not getting the vaccine, can have a worse kind of result. So I think having those conversations on a one-on-one and messaging those people separately has had a better impact for me to communicate on that space, because in a public forum, people feel like they need to say something that's going to get validated, and then it's just going to get escalated. And as you say, people have a short fuse. I know how low my fuse is. So I said, let me take it in a private forum in which I can reflect a little bit better and, just have that conversation with that person.
Absolutely. And I definitely agree. Having conversations one-on-one where it doesn't become a big flurry of back and forth and tension, and really missing the actual message because you're too caught up in everything else, is important. I would also probably argue that maybe adjusting the term side effect, I think it definitely makes sense to have people have realistic expectations of how they will feel after getting the vaccine. But side effect, because of the term and how it's been used for many years, does have this very negative connotation. When you introduce something to your body, especially with something such as a vaccine, you're going to have a response and or effect from the vaccine. I've had several patients that come in with a myriad of symptoms, including, swollen nodes in the neck and the arm, which is part of the body's immune system and what it will do after you do get an immunization, because your lymph nodes are where a lot of your immune cells live, and those will then be responding or having an effect from after getting the vaccine. Even some things up to feeling chills, having a fever, feeling run down and tired. It's your body having an effect from getting the vaccine. So maybe also thinking about changing the terminology we use around the effect of getting the vaccine is also something important when speaking to people that are understandably hesitant and or scared to go through something. Yazmina, have you come across any situations that have been very frustrating to you when trying to discuss the vaccine or have someone go and get the vaccine?
Not necessarily, but I've just to mention, I've been amazed by some of the people who will go get the vaccine. I've had a couple patients who they'd say they've had a history of, having really bad responses to, flu vaccines or just vaccines in general. There was one individual who said the last time that they had gotten a vaccine, they'd ended up in the ER. So I was amazed to see that they'd come in to get the COVID-19 vaccine because it's important to them, to move forward.
Absolutely. And Maria, any specific frustrating stories that you've been through?
So I would say specific frustrating stories. What I want to clarify is that every community may have different hesitancy issues with the vaccine. So it's very personal, and it's also very social at the same time. So it depends on who you're targeting. Here in Massachusetts, in this program that we're working with, we're in 20 cities, and every city has different compositions and different immigrant communities and different myths that are running. So it's frustrating that you have to address them, but at the same time, what an opportunity that we get to talk to them one-on-one and tell them and ask them, like, why are you on the fence? Tell us a little bit about it. And like, maybe we can address those issues. But specific communities, some communities are more hesitant than others, specific immigrant communities, and some religious communities are more hesitant than others. So we have some other concerns there. So it's just trying to find the right way of getting to those people. In some cases, for example, we partner with Hispanic pastors, evangelical pastors specifically, to ensure that we can actually get to their congregations, because there's a lot of hesitancy in those communities. So just wanted to highlight that every community may have different reasons for hesitancy, and not one thing doesn't work with all of them. So everything has to be hyper targeted and hyper local. And it's important to have that trusted source to give that information.
Absolutely. And that's reflecting back to what I said earlier about it's even more micro than a community level, right? It's individual sometimes. What are your specific concerns? How can I answer your questions? What data can I provide you with to help you with this very difficult decision for some? Darren, I know you spoke a little bit about some communities and some issues that you've had with people that have been hesitant, especially about putting poisons in their bodies and just kind of taking the holistic approach. A consistent thread that always pops up every so many years are concerns with vaccines giving you certain developmental problems or issues, especially with children. And I know that will become even more relevant as we lower the age that are able to get the vaccine. Are there any specific incidences that have particularly frustrated you, and what strategies have you used with those people?
Well, if I hear one more person tell me that vaccines cause autism, I think my head's going to explode. But for me, it's helping people to become present and pay attention to question what they think they know, right? It's really hard to get someone to change their mind about something, especially if they're in that hyper agitated state. So helping people to sit and get quiet and say, how do you know that? Like, somebody sent you a YouTube video? Like, when you say it out loud, it starts to sound a little crazy. Like, oh yeah, some person I don't know on Facebook sent me a YouTube video, and therefore it must be true. Helping them to calmly step back out of that agitated state. I think another thing, and this comes to the term side effect, and thank you for pointing that out. One of the things we try and do in yoga is reframe how people understand sensation in their body. And so recognizing that sensation can be pleasant or unpleasant, but pain, which is a specific kind of sensation, is like a warning signal. And sometimes you're doing like a yoga pose and it can be unpleasant, but it can be good for you. And sometimes things can be really pleasant and not so good for you. Cheesecake, for instance. And so when I bring that into a discussion on the vaccine, it's like, yes, you may feel a little uncomfortable after the vaccine, and that is a good thing. Just as feeling your legs burn a little bit in chair pose is a good thing, right? We want that. It means it's doing what it's supposed to do. And that's different than pain. Pain is your body saying, hey, I'm in danger. I need help. Get out of this situation. And helping people to nuance that a little bit so that feeling a little fevery the day after a vaccine is like, yay, look how awesome my immune system is. It's a totally different frame for them to understand it with.
Absolutely. Absolutely. Completely agree. Okay. Well, we have had a beautiful and wonderful and very informative discussion here. I just want to take the opportunity to wrap things up, but I would also like to end with a little bit of a positive note and would like to hear from each of you about somebody that you thought they're never going to get a vaccine. They're just very resistant, but through something that you said or was able to provide to them, they ended up getting it. And I'll start with you, Yazmina. Do you have any specific examples you'd like to share?
I don't, but just to reiterate what everyone's been saying, I mean, if I were ever to be approached or have a conversation with someone who was hesitant, you know, I know it's about having a conversation. It's about really understanding why someone feels hesitant or uncomfortable about receiving the vaccine and empathizing with that and telling them, you know, why it would benefit them to receive it.
Wonderful. And you, Alex?
Yeah, and you know, going back to that rephrasing of the conversation, I did have a conversation with one of the seniors. So you know, we lead this amazing thing called the poverty simulation. So a lot of the volunteers tend to be some of our senior citizens, and throughout the whole time, I remember speaking with one in particular, and she called me to see, hey, when are we ever going to have? We're going to have another poverty simulation. And I pivoted the conversation to say, so are you considering getting your vaccine? Because we had a previous conversation. She doesn't trust it. She didn't think it was going to happen. And sort of, I said, well, have you spoken to so-and-so? They got the vaccine. I got the vaccine. Some other people got the vaccine. And as you can see, they use a lot of the clips in the media, the nurse kind of like fainting while she was doing all of that. And I, you know, it was sort of to have that conversation and say, listen, you need to talk to your doctor de cabecera or PCP, as you know, and say, talk to your doctor. I think it's very important that you have that conversation with your doctor. And then, you know, if you have any questions and you're not sure, let me know. I'll even go with you if you need to, if you need me to be there. And it was nice to hear that she did sign up through our programs, because we were signing up the seniors through the website in order to get that happening. And she signed up, and it was great to hear that she was able to break that barrier because she was able to ask different people their experiences, and she weighed out the positives and the negatives, but it was a positive thing for her to be able to communicate with them.
That's wonderful. And also you helping to navigate that and point her to the right sources. So that's great. And Darren?
You know, when I got my second vaccine, I did the Facebook post of, hey, I'm vaccinated. And I was doing it more like a celebration for like, yay, I get to start to restart my life again. And I have had so many people, some publicly on, you know, on my wall, but many private messages where people are just like, I'm sort of on the fence. How did it go? Did you feel really icky? And many yoga students, but also friends who lean in that sort of like question the pharmaceutical company camp, who have said, you know, now that you've done it, I think I'm going to do it. And a few actually have followed up and said, I got my vaccine and I was fine. I took my Advil and it was no big deal. And I think that a lot of this work is, for what I'm learning, is it's really a one-on-one, where somebody you know, somebody you can relate to, not necessarily your doctor. It might be your doctor, but it might be your best friend or your accountant, who knows, but somebody you just connect with, you relate to, goes first. and shares about it, and the world didn't fall apart, and their head didn't explode, and they don't have autism, you know, and just like helping them to say it's okay. And that for me has been the best thing. Like all the planning of what am I going to say, just like go live my life, and people tend to follow. It gives other people permission to be brave.
Absolutely, absolutely. And Maria?
So I'm very fortunate to be in a bubble technically, because like when I posted on Facebook that I got my first vaccine or my second vaccine, I'm originally from Spain, and people there were like, you're so lucky because you already have it, and they were, because they're a little bit behind over there. And just my friends here, they were like all happy. However, I did have some conversations with people that didn't have the vaccine, and I have part of a mentorship program for young people, and one of them told me, I don't need the vaccine because I'm young, and that happened last weekend. And I'm like, oh, this is my opportunity to like show my skills. And I started telling him, I'm like, I know how much you want to serve your community and your family. This is like the first thing you can do. And I apologize for my kid because he just came back. You know, it felt so good to be able to have that conversation. But I do have to say that this is the beginning of that process that Alexander was talking about, that you need several conversations to get there. So it's not that I'm like obsessed with like getting this to the finish line, but this is an opportunity to like have several conversations to make that move, and for this person to feel more comfortable about getting the vaccine. And looking at Yazmina as well as a young person thinking, you know, I don't need it, I'm young, I'm healthy. And like those are different conversations, but we do need to have more conversations with young people.
Perfect. All right. Well, thank you. And we'll continue to have the discussions and conversations, and hopefully we will get there eventually. Thank you everyone for joining today. If you are watching and you have additional questions or concerns, please do put them in the comments, and subscribe so that you can continue to get updates from us and notifications about future question and answer sessions. Thank you again, everyone.